Hello, I'm Dr. Fiona. Today, I'll be sharing my personal experience of getting the COVID-19 vaccine. Now, before I start my sharing, I'd like to explain why I'm choosing the vaccine. Well, as we know, COVID is here to stay and it's not going to go away anytime soon. Hence, the only logical option is to get vaccinated unless you'd like to stay home for the rest of your life. Well, what about the side effects of COVID-19 vaccine? If you think about it, everything we take has side effects, even the normal Panadol. Now, with this COVID-19 vaccination, some of the common side effects listed are having a bit of fever, feeling tired, having muscle pain, and maybe some flu. More rare side effects are if the person has an allergic reaction to the vaccine. Now, getting a fever, feeling tired, having pain is a normal reaction because why? It's telling us that the vaccine is actually working. Now, how does this vaccine work? The vaccine aims to give us a mini flu to teach our body how to protect against the actual virus itself. Anyway, if it's not severe, these symptoms will go away within a few days and you will be back to normal with your body better protected against the COVID virus. Now, going for the vaccination is very stressful unless you prepare properly for it. I'd like to share a few tips of what I did to prepare myself for the vaccination. Number one, don't think too much about it. It's just like going for exams. Whatever it is, it has to be done. So, just go for it, get it settled, and that's the end of the story. Because sometimes when you think too much about things, you start getting imaginary symptoms even before you get the vaccine. So, just go for it. Tip number two, wear something comfortable which will make it easy for people to give the vaccine. This injection is going to be given to the top of the arm, so it's advisable either you wear sleeveless clothing or if you need to wear sleeves, wear something where the sleeves can be rolled up like this so it's easy to get the injection. Tip number three, if you're scared of any potential side effects of the vaccine, it's good to take the day off so you can rest at home and monitor for any problems. Lastly, for verification purposes, don't forget to bring your personal documents such as your identification card, the MySejahtera app, and other documents if necessary. The process of getting the vaccination itself is pretty simple. There are 5 stations. At the first station, they will check your temperature. At the second station, they will verify your documents such as the IC and the MySejahtera app. At the third station, you'll be given a short briefing and then asked to sign consent for the vaccine. And finally, at the fourth station, you'll be given the vaccine. After that, at the observation bay, you'll be observed for a period of 15 minutes to half an hour before you'll be allowed to go home. If you've gone for the vaccination, you will notice that they do it in batches, about 4 to 6 people. Now why? This is because when the COVID vaccine is diluted, 1 bottle of vaccine can be given to a certain amount of people. For example, for myself today, I got the Pfizer-BioNTech COVID-19 vaccine, or otherwise known as the Comirnaty vaccine. The word Comirnaty actually comes from a mixture of 3 words which are COVID, mRNA, and community. Once you reach the vaccination station, first they'll check your documents, then they'll actually show you the bottle of vaccine for you to confirm the name of the vaccine and have a look at the expiry date. Then they'll withdraw the required amount out of the bottle. Now this is a syringe filled with water. As you can see, it is a 1 milliliter syringe. For the Comirnaty vaccine, it's recommended that you get 0.3 mils of the vaccine, which is about this level here. As you can see, each mark represents 0.1, so 0.1, 0.2, 0.3 mils. Once the dose is confirmed, they will roll up the sleeves like this. They'll use an alcohol swab here. They'll use an alcohol swab to wipe the area which they're going to inject. Then they will use the needle and inject into the arm. The whole process should take less than a few seconds. Now for needles, it depends on needle size. The bigger the needle, the more painful it is. However, for this injection, they're using super small needles, so you barely feel the injection itself actually. Actually, I didn't feel the injection until after they injected it, but yeah, it's quite painless. Have you ever wondered why we inject into the upper arm? we're actually injecting into a muscle known as the deltoid muscle. The deltoid muscle is a large triangular muscle located in the shoulder area here. Injecting vaccine into the muscle is good because muscle has a good blood supply. This means that the vaccine can be brought swiftly to other parts of the body so it can start working. Also, because it's injected into the muscle, it stays longer and has less side effects compared to if you injected the vaccine directly into the blood vessels. After a few hours, you will start to get some ache in the arm. So what you can do to minimize the ache is this. After the injection, start moving the arms a bit. This way, you can go sideways, you can go every other way. Why? This is to encourage blood circulation in the arms to move the vaccine faster to other parts of the body. Because if the vaccine is localized to the arm and just stays there and you don't touch it and it doesn't move, what happens is the inflammation and the reaction is stronger and worse there. So it's good to move the arms around. Also, if you can do some moderate exercise, this will further promote blood circulation and boost the immunity of the body. If you are afraid that you will get fever symptoms, drink lots of fluids and get plenty of rest so that the flu symptoms will go away faster. If you have severe symptoms, don't forget to contact your local health provider. This video is actually filmed about 6 hours after the procedure. Now, as you can see, let me take the thing off. After the vaccination, they'll give you a plaster here. So I'll take the plaster off and show you what it looks like. As you can see, there's literally no mark. Can't see much at all of the vaccination. Even when I touch it, it's not that painful. Only thing is now, like when I raise my arm, it's just slightly tender. However, after I move my arms, it's actually getting better. So I've been lucky so far. So far, no symptoms, no fever, no flu. I feel like normal. Anyway, I'm excited to get my second dose in 2 weeks' time. And message of the day, if you're not allergic to the vaccine, please get yourself vaccinated to protect yourself, your family members, and everyone else. Protect yourself, protect all. Thank you.